a real core driver is how those demographics are changing, how this population in the United States is aging. And so we really see an uptick in utilization in both the volume of services, but also the acuity, the complexity of services as people age.
I'm here today with Todd Meredith, President and CEO of Healthcare Realty Trust. What are some of the core drivers of the outpatient medical facility business, and what makes it a unique property sector for an investor?
Well, thanks, Diane, for having me. Really, the outpatient medical sector, if you think about it, is really buildings that house physicians. So these are physician practices that are seeing patients in their offices, providing a wide range of outpatient services. And so if you think about it, it's really about demographics, the patients. Patients of all ages need to see the doctor, from babies to elderly folks. But that increases as we age. So a real core driver is how those demographics are changing, how this population in the United States is aging. And so we really see an uptick in utilization in both the volume of services, but also the acuity, the complexity of services as people age. So what we see statistically is that on average, if you're under 45 years old, you go to the doctor about 2 times a year. When you get over 65, it goes to about 6 times a year. So that's a triple. That obviously that increases utilization, but also the complexity. So you can see that's a huge driver of the utilization of outpatient care. The other piece to that is that 65 and older cohort is growing. It was in maybe 10 or 15 years ago, that was 13% of the U.S. population. It's expected to reach about 20% of the population by 2030. And so that's not that far off. And so you see a rapid growth in the volume of those older folks that need more care. And then I think the last piece is really the fact that outpatient medical setting, out in doing more services out of the hospital and doing more in the outpatient setting is an accelerating trend as well. It's been going on a long time, but as technology improves, as clinical care delivery has innovation, they basically will do things like a hip surgery in an outpatient surgery center rather than the hospital. So you're seeing more and more being done in the outpatient setting. So all those things are driving more and more utilization of our buildings.
Have rising interest rates impacted the supply or demand for outpatient medical facilities?
In the short run, it really has not. Medical office tends to be a pretty tight supply situation. We tend to invest primarily around hospitals, try to have hospitals at the center of the locations we're investing. And those are pretty dense areas. The hospital has a fair bit of control over what can go around on their campus. So you have some natural supply barriers. But I would say the one benefit we see with inflation causing replacement costs, construction costs to be higher, plus financing costs to put together a new building are higher. So it actually becomes a higher barrier. It's going to be harder for developers and others to build new buildings at rental rates that are affordable. So we actually see that as a benefit to our existing buildings and a supply constraint.
And turning to the HTA merger that closed in the third quarter of 2022, what strategic benefits will this bring to your outpatient medical platform?
Sure. We're just under a year past the closing of the merger, and we're already seeing a lot of benefits. We talked about this going into the merger, that we saw great benefits of scale. And it's not just scale as a company, although there are some benefits there in terms of cost efficiencies. But what we really see is market scale and that advantage. And we put the two portfolios and the two companies together. We saw our portfolio come together in much greater scale across a number of key markets, really attractive markets. Some of our top markets are places like Dallas, Denver, Seattle, Atlanta, Charlotte, really strong markets. And we now have over 1 million square feet of medical office in those markets, in really 15 markets. And that's about 60% of the portfolio. And then if you go down to about 500,000 feet, another key level of scale, it's 26 markets, almost 80% of the portfolio. So it really advantaged us to have more scale in markets. And what that really brings you is more relationships with health systems. You have more in that market. You're seeing more transactions, leasing transactions in that market, more developments. You have stronger relationships with these health systems, and frankly have more to offer those physicians, those health systems that want space, so you can solve more problems for the customers. So we see a lot of advantage in that in terms of really running our portfolio more efficiently, also on a cost standpoint. So we're seeing already a ton of those benefits come through just a couple, 2-3 quarters in. We're really starting to see it in terms of the engagement on the leasing side. That's really where we're seeing it. And what we put out in terms of guidance recently is that we see really strong results coming to fruition in 2024. So we're looking at same-store growth being maybe 4 to 6% in 2024, whereas the industry is known for sort of 2 to 3. So we're really seeing some tremendous acceleration, which we're really pleased with.